Here are two USMLE-style questions incorporating the mnemonic for decreased granulocytes. Mnemonic: some bacteria produce no serious granules. Staphylococcus, Burkholderia cepacia, Pseudomonas aeruginosa, Nocardia, Serratia. This mnemonic helps recall granulocyte-targeting pathogens in conditions like neutropenia or granulocyte dysfunction, e.g., chronic granulomatous disease, agranulocytosis. Question 1. A 5-year-old boy with a history of recurrent skin abscesses and pneumonia is found to have a defective oxidative burst on flow cytometry, dihydrorhodamine test. Cultures from his most recent infection grow Serratia marcescens. Which of the following best explains his predisposition to this infection? A. Defective T-cell receptor rearrangement. B. Defective CD40L expression on T cells. C. Deficient production of reactive oxygen species in neutrophils. D. Impaired class switching of B cells E. Deficiency of complement factor C3. Correct answer C. Deficient production of reactive oxygen species in neutrophils. Explanation: this is classic chronic granulomatous disease, CGD, which involves defective NADPH oxidase respiratory burst. Patients are especially susceptible to catalase-positive organisms, particularly granulocyte-targeting pathogens. Some bacteria produce no serious granules. D == cast staph, Burkholderia, Pseudocardia, Serratia. Why not the others? A. TCR rearrangement would present with broader infections. B. CD40L defect, hyper IgM syndrome, mainly affects antibody class switching. D. Class switching defect affects humoral immunity, not neutrophil function. E. C3 deficiency increases risk of encapsulated organisms, not catalase-positive ones. Question 2. A 24-year-old man undergoing chemotherapy for leukemia develops fever and is found to be neutropenic. Blood cultures grow Burkholderia cepacia. Which of the following is the most likely cause of his increased susceptibility to this infection? A. Decreased B lymphocytes. B. Decreased complement activity. C. Decreased neutrophil count. D. Defective T-cell activation. E. Impaired mucociliary clearance. Correct answer C. Decreased neutrophil count. Explanation: this patient is neutropenic due to chemotherapy. Neutrophils, granulocytes, are essential for defense against Burkholderia cepacia, a high-risk pathogen in neutropenia. Mnemonic: some bacteria produce no serious granules, helps recall these threats in neutropenic patients. Why not the others? A. B cell loss increases risk of encapsulated organisms, not these specific ones. B. Complement deficiency especially affects Neisseria and encapsulated bacteria. D. T-cell issues lead to viral, fungal, and opportunistic infections, not this profile. E. Mucociliary clearance, relevant in cystic fibrosis or PCD, not in this case. Would you like a